ready to go here? All right, with that, we'll call the meeting to order and start with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Do we have any public comment?
No.
Nobody signed up for public comment. We'll move on to 4, approval of the October 1st, 2025 Health and Human Services Committee meeting minutes. Do I have a motion? Motion made. Do I have a second? Second. All in favor, signify by saying aye. Aye. Any opposed? Motion carried. Thank you. 5, operational functions required by statute, ordinance, resolution, or policy. Discussion and possible action by Health and Human Services Committee applying for Wisconsin Department of Veteran Affairs County Transportation Grant. Do you want to, she's going to flip-flop them. Is there any objection to flip-flopping A1 with B1 first? No objection, then go ahead.
Thank you, Supervisor Boots. I thought it made more sense to talk about the money we know we're getting first, so before asking about applying for new money. And also Aaron Galindo with the Veterans Office is on his way here. I don't know if he'll make it in time or not, but so B, the 8521 program, this is our annual application to the state for specialized transportation assistance. We are eligible to receive $366,000, of which the county brings forward a 20% match at $73,000. This is to provide services to our elderly and people with disabilities within our community. We do have an RFP with Metro Ride and North Central Healthcare in order to provide those services. So every year we work within that agreement to give those services within the county. So this item on your agenda today is just to approve us going forward with applying again for the 2026 funds. I'll take any questions.
Any questions?
Because my,
All right, with that, we'll move on to 5A1.
no, we need a motion.
Oh, motion, I'm sorry. I got a motion. A motion, do I have a second? Second. Any further discussion? If not, all in favor signify by saying aye. Aye. Any opposed? Motion carried. Again, I guess for the second time, we'll move on to 5A1.
Okay, so moving backwards, the first item in your agenda packet today is to talk about applying for something known as the County Transportation Grant. I realize the subject line on the memo is incorrect. We have been doing a lot of memos in the last week, so we are not here to talk about the solid waste strategic plan. That was yesterday. But so Supervisor Zhang brought forth to county staff that the eligibility for what's called the County Transportation Grant, which is a fund that helps provide transportation to veterans, has expanded its eligibility within the state to include Marathon County. So staff worked with the administrator to look into the program to see if we thought this was something that could be a good source of additional funding for transportation services within our county, and decided that we wanted to bring it forth to ask for permission to apply. A couple things to know about this grant is it's a reimbursable grant that provides services for veterans to the Veterans Administration appointments. So it does have in statute definitions of what makes a veteran eligible to use these services, and it is reimbursement. So we would apply for the funds, but they will tell us based on our estimate how much we can anticipate receiving, but we don't know exactly how much we would get from the state. They have advertised they have up to $200,000 available statewide, but that's amongst the 72 counties, and it will be dependent on what we're demonstrating as our need as well. What we're envisioning is working with our existing transportation providers of Metro Ride and North Central Healthcare to supplement our 8521 program. So we would be able to take our 8521 program funds further for our elderly and people with disabilities by using these veterans funds towards those rides that we're already giving to veterans to the VA. Let's see. One of the things I know Aaron would want me to mention is the expansion of the program is definitely looking at how we can expand to more of the rural areas within the county as well. So that's one of the things that we would be looking at. We know from talking to North Central Healthcare right now that they estimate they provide rides to the VA for 6 to 10 veterans a week. If this program works successfully, we would be trying to expand that more into our rural areas too, to get more veterans from the rural areas into their VA appointments. If they are currently using our 8521 program, they do have to pay a small fee. So this would actually allow us to give them those rides for free. Thank you. So our timeline right now is that we're looking for approval from Health and Human Services and the county board to, or I'm sorry, we just need Health and Human Services to apply by December 1st, 2025. We expect to be notified in early 2026 about the award, and then we would implement logistics and conduct outreach. And then we would start applying for quarterly reimbursement and determine whether or not we want to reapply in 2027. The Transportation Coordinating Committee did take this up at their October 23rd meeting and did recommend moving it forward to Health and Human Services for approval.
Was that unanimous?
Yes. Yeah, so this is an expanded eligibility of the program. Originally, in the old rules of the program, Marathon County did not believe we were eligible, but now we are, so.
Questions?
So Administrator Leonard is asking about that Metro Ride does not currently provide service to the VA because that's outside of their service area. What we've talked about with Metro Ride is that they could actually provide the rides to North Central Healthcare, and then North Central Healthcare could take them to the VA. So, and Metro Ride is open to having those discussions about expanding that in the future if this becomes a need that they could service, so.
Questions, concerns, comments? If not, can I get a motion? We have a motion on the floor to approve. We have a second. A second. Further discussion? None. All in favor signify by saying aye. Aye. Any opposed? Motion carried. Thank you.
Thank you, and we will, as Lori said, we'll report back based on the results of our application to let the committee know if we're successful. And because we did not build this into the budget for 2026, if we are successful, we'll bring that back and we'll do any necessary budget modifications in light of the funds that we'd be anticipated to receive.
All right, thank you. Number 6, education presentations and community discussion. Update from North Central Healthcare. I had Administrator Leonard put this on the agenda.
Sure. And Jason Hake is en route. He had a meeting that ran a little bit long, so to keep in, moving in the same direction as your agenda has been to this point, we could flip-flop around.
No objection. Can we take B instead of A? No objection. All right, no objections. Go ahead there, Administrator Leonard.
Thank you, Mr. Chair. So just again, having the conversation or allowing for the conversation relative to budget for each of the standing committees. So we had the public hearing, the county board meeting for the public hearing on the budget. This is again an opportunity for discussion if you have any questions. HR Finance and Property Committee Chair Robinson is here. Of course, all of your process for any amendments calls for those amendments to be submitted on Friday morning so that they can be put into the packet for the HR Finance and Property meeting the ensuing week, as well as the county board meeting for consideration. But to this point, we have department heads in the room and others in the event there are questions or you want us to assist in any way. I don't know if there's anything else that Chair Robinson wants to highlight.
All right, with that, we'll open it up to the committee or any other board member. I think we have Supervisor Marash on as well. So if anyone has anything they'd like to discuss, now's the time to bring it up on the budget. All right. That's it, I guess. Then we'll move back to 7A or 6A. Update from North Central Healthcare. I just seen him walk in, so.
Yeah, you want to come on up? So Jason Hake is here from North Central Healthcare, as Chair Boots referenced. Chair requested an update from North Central on operations and things in the works. I don't want to steal some of Jason's thunder, but I will. He's here, I think this is the first time he's been before you in his new role as acting executive director of North Central Healthcare. He was appointed by the executive committee at the end of September to serve in that role as Gary Olson transitions into an advisory capacity before his well-deserved retirement from a long career in public local government. So with that, turn it over to Jason.
Great. Well, Lance stole my thunder. So yes, I have stepped into that role in September, and really, I guess I'd just like to give a little bit of background just about myself, where I came from. So I've been at North Central for just shy of 3 years. Prior to joining North Central, I was most recently at Aspirus as the Director of Finance. But prior to that, I was in county government for 8+ years. I started my career in Portage County in Health and Human Services and Finance. I was in Lincoln County as the Administrative Coordinator, and then in Marathon for a short period of time as the Deputy. So have the county side of things, but also the healthcare side of things. And I think that works and fits really well at North Central Healthcare because we're such a unique, kind of a unicorn. But at the end of the day, we are county government that happens to operate a hospital and a skilled nursing facility. So having that experience has really been beneficial coming in here because there are a lot of things that we do that typical counties don't. So that's certainly been helpful for myself and the organization. So stepping into this role, I guess one of the things that I really want to do is just to continue to build off of the success that we've had over the last couple of years. I think we've seen a lot of success in the organization. Coming out of COVID was certainly challenging, and I'd like to just highlight some of those successes that we've seen, and I'll kind of break those down between our behavioral health services and the Mount View. So in behavioral health services, we have really aligned our services with the counties. That was an expectation set by the executive committee. They provided a desired future state to really align and prioritize county services. So that's something that we've really strived to do over the last several years. And with that, we have seen an increase in census. So we're serving individuals locally rather than sending them outside of the county, which then also has positive impacts on our financials for the organization. We've also increased our contracts with other counties. So right now we have contracts with 32 other counties in the state to utilize our inpatient services. So that's a huge number. And in 2025, we have onboarded 2 full-time child psychiatrists, in-person child psychiatrists. That's a huge milestone for this organization. And one of those was a resident that we served at North Central Healthcare through the Medical College of Wisconsin partnership that we have, our MCW collaboration. So part of having that medical college locally here was meant to keep individuals in rural communities. And because North Central is so unique and has such a huge, a large continuum of services, we provide an opportunity for residents to come in and kind of get the whole continuum of care. And nobody else has it in the state. So we're really fortunate to have that here. And it's paid off for us as we have not only recruited one of those residents, but part of our recruitment of other psychiatrists is because they want to come in and work at an organization that helps teach others. So that's been a recruitment and a retention tool for our other psychiatrists. That's how we were able to hire our inpatient child psychiatrist. Was she wanted the ability to work with residents. So it's been that partnership has been huge for the organization. And then just to kind of piggyback off of the 32 contracts with other counties, we got some exciting news last week, and our team was down at a conference yesterday, and they were able to and accept an award from the Wisconsin Children's System of Care Champion. We were one of 19 that were nominated for this award in the state. And really what it is, it's recognizing North Central for the dedication and hard work from our team by supporting the health and well-being of children, young adults, and families, not just within the Tri-County area, but with all the counties that we serve. So that's really exciting as we've really tried to align our services more with the counties. I think we've done a good job of that, and it's nice to be recognized that that DHS was able to recognize that and nominate us for that award. Mount View, we've seen some pretty significant successes over the years as well. We've seen some huge rate increases there, which has helped our cash position. We've increased census every year over the last 3 years. We have seen a little bit of a dip in the last in the summer months of this year, but that's ticked back up and is higher than we've seen in all of last year. So that's good to see. We've had some leadership changes there. We have a new nursing administrator and department or director of nursing, but we brought in two interim folks to fill those roles, both with a lot of experience. And one thing that we've really seen is just having a fresh set of eyes there has really opened us up to how can we do things differently, more efficient, provide higher quality of care. So that's really been really nice, and we've really figured out how we can increase our quality of care, but also our compliance within Mount View. So we've made a lot of progress over the last month with that. Overall, just as the organization, we've seen a huge turnaround in our cash position. When I started at the organization, I mean, there were days where we were worried about, checks bouncing. And I'm happy to report that right now we have about 125 days cash on hand. So we went from, a couple $1 million to having about $32 million in cash. So a lot of that is due to the increased census and Medicaid rate increases that we've seen over the last couple of years. Some other initiatives that we've implemented is centralization. We've centralized procurement, compliance, quality, learning and development. And that really has helped create efficiencies and consistency throughout the organization. And really we're trying to place a strong emphasis on the quality and compliance piece. And that's something that being decentralized was a really big struggle. And by having that roll up under one department has really helped create consistency. And we've really learned from other departments and how we can do things better. And then retention or recruitment, has been a big one as well. So in 2024, we had, and I guess it plays into retention, our employee referrals from the individuals that we hired was about 7%. And in 2025, we've increased the number of employee referrals from 7 to 31% in 2025. So our employee referrals should be one of our largest recruitment tools, and we've seen a huge increase there. So I think that shows that employees hopefully are happy that they're recruiting individuals to work here, but individuals are staying, and they need to stay 90 days to get that bonus. So seen a huge increase in the number of referrals in that program. Certainly we've got challenges just like everybody else. One of the largest ones is just staff, labor market, competing with other counties, but also competing with healthcare organizations. That's probably our biggest struggle and will continue to be our biggest struggle. And health insurance is another large challenge that we're gonna be faced with in years to come. And then just legislation changes. So we've seen some pretty big and significant changes. We have the Big Beautiful Bill that was passed. We think that will have some type of impact on the organization, but it's too early to tell right now. There was some telehealth extensions that expired October 1st, so that's creating a little bit of a challenge for us. And we're trying to navigate that as right now. Our increased costs are outpacing our revenues, not unlike the county. So trying to navigate that, and then just some future large capital investments that we're gonna need. A lot of challenges, but we've made a lot of progress over the last couple of years. So really, what I want to do is just continue to build off of that success. One of the things that we're going to be implementing in 2026 is a strategic plan. So we want to make sure that we're aligning our needs, or continuing to align our needs with the counties, but also ensuring that internally we've got that continuous improvement. Emphasizing through the strategic plan quality of care, although we serve the most vulnerable population, which can be difficult at times, it doesn't mean that our quality should be any less than individuals or organizations that are serving a different population. And then just the continuing to have good fiscal and financial sustainability. So we've done a pretty, I think, a really good job of limiting our tax levy to the 3 individual counties. And we didn't increase or ask for an increase this year. And we, through the debt repayment schedule, had to come up with another $500,000. And that will increase $500,000 up to about a little over $4 million, 4.1. So that's something that we're, going to be working really hard on, is limiting the levy impact while making sure that we do everything we can to make that debt payment. And as of right now, we're on pace to continue that. Certainly, you never know when circumstances outside of our control could affect that, but right now we're in a really good position to continue to meet that debt payment. So, and then probably the last thing that Lance and I have just talked about is just like, how can we work more closely together? How can we leverage the innovation grant program? How can we leverage that with Lincoln and Langley counties? We're always looking at how can we partner? How can we do things more efficient? How can we work together? So we really view ourselves as a department of all 3 counties. We've got really good relationships with the 3 counties right now, and really just looking at how we can continue to improve those relationships and work closely together. We know it's not going to get any easier on our end when it comes to the financials, and it's not going to get any easier on yours. So the more we can work together and find efficiencies, the better off we're all going to be.
Any questions?
If I can add one thing, or more than one. So Jason brought up cash on hand. Kurt and I serve on the executive committee. I can't tell you how big of a change we've seen. I mean, that is not an insignificant change when we talk about the growth of that cash on hand. So that's a good thing. I want to also word of caution. It's kind of like the reserve and fund balance policy that you've all approved at the county board for the county. The 120 days of cash on hand doesn't mean we shouldn't ever look at that as, let's decrease our tax levy support to North Central Healthcare. They need to have that. I mean, that's prudent. Every county that I'm aware of for their Health and Human Services Department has such a reserve. The thing, I think one other opportunity to build on, Jason referenced capital needs. The capital need that we don't always think about, or that's a little bit different than the bricks and mortar, is the IT side of things. And North Central relies heavily on, they're operating a number of very specific businesses. In addition to, just like the county, we have our HR and finance system, our ERP system. They have one as well, and theirs needs updating. That's not an insignificant expense. Similarly, they have software that they use within their various programs that are going to require those updates. And then, as Jason referenced with the debt service or the repayment to Marathon County for the previously issued debt, I think the opportunity exists for us to work with Jason, the executive committee of North Central Healthcare, to sit down and say, okay, let's do the similar exercise we did at the county with take a good look at our cash on hand and how much do we want to identify and, for lack of a better term, designate for those upcoming projects that we know are on the schedule. You know, we can't put off planning for what does that HR and finance system look like? What does that debt service look like? Right now, to Jason's point, it's $3 million in 26. 27, 3.5, 28, 4, 29, 4.15. And then that number stays there for quite a number of years. So it's prudent to plan and set aside and designate some of those funds because I'd love to live in a world where every year was better than the year before, but we know we're gonna have years where, for whatever reason, oftentimes things outside our control, and we don't know what the impact is going to be of the recent legislation with people losing that, losing health coverage. And that doesn't mean we don't serve them. That's why it matters to us. We serve people regardless of what their payer source is. That's what government does. So we're gonna need to plan. And so how do we make sure we set some funds aside for when those lean years do come? What does that look like? So a lot of good things happening at North Central. And again, I did steal his thunder with his appointment. But sorry to interrupt, and if there are any questions, certainly Jason can take them.
So we did have a question from Supervisor Mirage. Go ahead.
Thank you, Mr. Chair, and I apologize for not letting you know I was attending earlier, but I had just been informed this afternoon from a constituent about North Central Healthcare, and so I wanted to take the opportunity to ask while I had this chance. So it seems that you did mention, Jason, that there was a lot of different positions being filled or different people taking on different roles. But what I heard was, these are the words that were used to me, was there's been a shakeup, a major shakeup with several team members being terminated. So could you explain more about that, if that indeed is true, that long-term employees have been terminated and been replaced? And it just, your explanation of everything going on paints a really rosy picture, and I was disappointed to hear what I did today. So that's my question. Thank you.
Yeah, I can't really speak to, you know, employment matters of individuals. But as I referenced, we have seen a leadership change in our nursing home with our nursing home administrator and director of nursing leaving. But I can't really speak to individual employment matters.
Follow-up, please.
Go ahead.
How are the CNA numbers looking? I know that they were significantly down and we are having a hard time recruiting people for those positions. Is that improved at all?
That certainly, it ebbs and flows. Right now, it's always challenging this time of year when we start to head into the holidays. But then in the summer months, it's always better because we have college kids coming back to work in the nursing home. And right now, you know, those individuals have gone back. So this time of year is always a little bit challenging. People want off work, but the numbers have been pretty consistent. What we have been utilizing is more agency staff. That's something that we haven't wanted to do, but just to help relieve some of the open shifts and the stress and give the current employees a better work-life balance, we've been utilizing more agency staff over the last year.
Go ahead.
Well, thank you, Mr. Chairman. Jason, could you elaborate a little bit? I know we continue to look at what the challenges of the One Big Beautiful Bill and some of the potential Medicaid cuts and Medicare challenges. How you and your staff have looked at, and the executive committee has looked at, you know, how do we plan for that? because we do anticipate that will create some significant challenges moving forward, and how that leans into appropriate financial planning for those challenges.
Yeah, right now, we don't know what that impact is gonna look like, right? But we know that individuals are going to lose coverage, and we know it's gonna be harder for individuals to maintain coverage. So we anticipate seeing, well, we haven't heard from the state of any programs being cut from that. So what we think is we will be serving individuals that do not have insurance coverage, which then on our financial statements shows up as what we call charity care. So it's not a write-off, but it's, we're serving somebody that does not have insurance. What we then do look at is, do they have an ability to pay? And if they do not, then that would be, showed up as charity care. Now, the planning is really difficult because we don't know what that impact is gonna be, but we're keeping a very close eye on that. I know WCA is aware of that, the Hospital Association is aware of that. So there's a lot of advocacy that's going on at the state level. I've talked to DHS, I've talked to the director of Medicaid at DHS. Good news is he comes from county government, so hopefully we see less impacts than others, but certainly no guarantee at this point. I think what's gonna be extremely important is, Lance hit on this a little bit, is although it sounds like we've got a lot of money and cash on hand, it's gonna be really important that we maintain that and keep a close eye on that. We review our cash every day, but we're gonna wanna have a healthy cash reserve until we can figure out what that impact is gonna be. We're not gonna have a lot of time to lead time to know what that's gonna be. We anticipate DHS getting an additional direction from the feds next year, probably in June or July, and they're gonna have 6 months to make their changes. And then we're gonna be able to get a better understanding of what those changes are, but we won't see that impact until 2027. So, yeah, I mean, it's gonna really be just keeping a close eye on things in the future and working with other counties. I mean, the good news is what affects us is gonna affect every county in the state, and it's gonna affect every hospital. So we've got a lot of eyes and ears out there.
Thank you.
Further questions? All right, thank you. All right, then we'll move on to 7, next meeting date, time, announcements, and future agenda items. Any announcements by anyone? All right, committee members are asked to bring ideas for future discussion. 7B, next meeting, Wednesday, December 3rd, 2025 at 3 p.m. And I will take number 8. Motion to adjourn with a second. All in favor? Aye. Any opposed? Nobody.